coding guideline 1C6B is pretty extensive, so we're going to break it down, and in this video we're just going to focus on the coding guideline information at 1C6B1, and this is the general coding information. So it says that codes in category G89 pain, not elsewhere classified, may be used in conjunction with codes from other categories and chapters to provide more detail about acute or chronic pain and neoplasm-related pain, unless otherwise instructed below. If the pain is not specified as acute or chronic, post-thoracotomy, post-procedural, or neoplasm-related, do not assign codes from category G89. So it might be helpful if we take a closer look at what's in G89 at this point, so we can see what they're talking about. So G89 codes can be at 0 for central pain syndrome. They can be at a .1 with additional characters needed for acute pain, G89.2 with additional characters for chronic pain, G89.3 for neoplasm-related pain, and G89.4 for chronic pain syndrome. So then it says a code from category G89 should not be assigned if the underlying definitive diagnosis is known, unless the reason for the encounter is pain control, pain management, and not the management of the underlying condition. When an admission or encounter is for a procedure aimed at treating the underlying condition, such as a spinal fusion procedure or a kyphoplasty, a code for the underlying condition, for example a vertebral fracture or spinal stenosis, should be assigned as the principal diagnosis, and no code from category G89 should be assigned. So I think if we take a look at a clinical scenario, it'll help us to apply this. This is a 46-year-old male patient seen to evaluate chronic left knee pain. So in this case, we need to say that it's knee pain because that's what we're evaluating, but the code for knee pain is not descriptive enough to include the chronic part. So we're going to come up with two codes. But to path, we just simply start with pain, and we say joint, knee, and we come up with M25, 562, or 56, and then we go to the tabular, and because it's the left knee, we choose M25, 562. Then to code the chronic pain, we say pain, chronic, and we're going to take the default code G8929 because none of the subterms apply. So we say G8929 and check it in the tabular and we're good to go. So in this case, because we are evaluating the pain, we decided to use the G89 code in conjunction with the code from the other categories and chapters because the G89 code does provide more detail, specifying that this particular pain in the knee is also chronic. Now let's look at scenario 2. This is an 83-year-old female who presents to day surgery for percutaneous thoracic kyphoplasty to address chronic back pain and to restore vertebral height. She has postmenopausal osteoporosis with a current pathological fracture of the vertebra at T3. Okay, so this part that we're looking at now has to do with a procedure that's being performed to treat the underlying problem. So she's having a kyphoplasty because she has this osteoporosis with a pathological fracture. So in this case, it says that when the admission is for a procedure that's aimed at treating the condition, then no code from G89 should be assigned. So the only code we need is for the osteoporosis with the related fracture. So the osteoporosis was described as postmenopausal, and it was also described with a pathological fracture, and the location was the vertebra. So the index gives us M8008, and we go over to the tabular, and we find out that at M8008 we need to have a seventh character, A, D, G, K, P, or S. In this case, we will select M8008XA for age-related osteoporosis with current pathological fracture of the vertebra, initial encounter for the fracture. In this situation, it is day surgery, so the procedure for the kyphoplasty would be coded in CPT.